Despite being a marathon runner and exercising and eating what I thought was the right diet, I was out for a run one morning and I developed this cramp in my chest that I thought was maybe the Chinese I ate the night before or maybe the humidity that morning. Found out I had 80% blockage in one artery and 70% blockage in another, which really surprised me.
And it wasn't until I got pregnant with my son that I started to really think about what I was putting into my body. When he was born, he also had some challenges as well in terms of digestive issues and was put on a couple of medications, one of which the pharmacist, thank goodness, actually warned me that it had potential to cause respiratory failure in a child of his age. So that led me to a point to say, there's got to be another way. So I went back to school and I studied at the Institute for Integrative Nutrition and then went on to study functional diagnostic nutrition. And so along the way, I jokingly say that I dragged my dad, Dr. Vinny, kicking and screaming over to the light side, from the dark side of the conventional medical world. And at first he was a bit skeptical.
I found that a lot of my patients, when I was in the conventional medical world, I couldn't give them the answers that they were looking for. I didn't have the tools. I had my own health challenges, which I didn't have answers to either. So when Jenna told me about this new way, this radical way of using nutrition as medicine and lifestyle as medicine, I was, as she said, skeptical. But I decided to go to the Institute of Functional Medicine. And when I took that first course, I was just blown away by the enthusiasm in the room and blown away by the science and the power of what I was hearing. And I've been learning answers to my own health questions as we've gone along. So, and the deeper I get into this, the more I find my own answers. So the typical patient who comes in is looking for answers that they haven't been able to receive in conventional medicine. It's about their thyroid, their autoimmune conditions. It could be about their heart, memory problems, brain fog.
We like to say that we don't treat patients, we work with them to co-create health. So we focus on not symptoms and not disease specifically, but actually driving at the root cause. I think people are looking for a paradigm shift. They're sick and tired of being sick and tired, and they're tired of the revolving door of healthcare, and they're ready to truly get well.
We spend an hour with them at their first appointment, even an hour and a half often, to really get to know them, to go through their comprehensive intake form, all their systems, because everything is interrelated. And we find that in conventional medicine, that's not often the case. It's, what's your problem, what's your disease, what pill can I give you for that? And we're very different than that.
So my role is to help people understand, despite what they've perhaps learned up until this point, that they do truly have control of their health, that the choices that they make every day, every hour, every minute can truly have an impact on how they live their lives moving forward.
If people don't believe they can get well, they won't get well. But if they believe they can, then they always find a way.
They can expect a support network. They can expect a coach. They can expect a teacher, a counselor, a cheerleader in many cases. We don't work with people who just come in for one appointment and they're out the door, right? We don't get sick overnight, so to expect to get well overnight is unrealistic. It requires a relationship, it requires a partnership. So the patients with whom we work actually become more like friends and oftentimes family.
Any questions that they have, we're available by phone, by email. So we want people to make sure that they know they're supported as they're going through this, both with coaches, but also clinically.
So if you're experiencing a health challenge, the first thing that I would recommend is just picking up the phone or, going online and filling out a contact form and providing some information on what's going on. We have a wonderful staff to take in that information and provide information back to you on our practice to determine if we're, a good fit for one another. You want to make sure that you're comfortable with your health team. So people can find out more about Princeton Integrative Health by visiting our website, which is www.princetonih.com. We also have a Facebook page, which is just Princeton Integrative Health, and also a wonderful Facebook community where we've brought together like-minded individuals to share information, questions, support, and that is Princeton Integrative Health Community.